Leprosy is a long-term infection that can be lifelong. People with leprosy have no symptoms for 5 to 20 years. Then they develop masses of granulation tissue called granulomas on the nerves, respiratory tract, skin, and eyes. In 2005, geneticists traced the origins of and worldwide distribution of leprosy from East Africa or the Near East along human migration routes. The oldest evidence of the disease dates from 2000 BC, as found in human skeleton remains in India, which currently has the largest population of lepers in the world. However, there are various ancient writings in India, China, Pakistan, and elsewhere that describe leprosy. Leprosy comes from the Greek word lepra, meaning scabs or peeling. Someone who has leprosy is called a leper. There are 7 lepers mentioned in the Bible, although some say that the leprosy of the Bible is not leprosy as we know it today. Leprosy has a stigma with it, as early Jews believed that leprosy was punishment from God for sinful behavior. If someone came near a leper, the leper, by law, was supposed to say, "Unclean," to warn others to stay away. In Europe in the Middle Ages, lepers were considered to be of immoral character. They were also institutionalized and put into leprosoriums. If there were no leprosoriums nearby, they had to wear clothing that identified them as such, or they had to ring a bell to announce their presence. In 1898, India passed the Leprosy Act of 1898, which called for separation and segregation of lepers. Men and women could not be together because the government wanted to eliminate reproduction of lepers. Anyone who married a leper would be punishable by law. In 1983, after successful treatment was discovered, the act was repealed.
उसके 5-6 साल बाद मेरी बीमारी आ गई। तो जब बीमारी आ गई ना तो हाथ थोड़ा उंगली टेढ़ी हो गई रही, तो मेरे हस्बैंड घर से मार के निकाल दिए रहे।
Today, leprosy is most prevalent in India, Brazil, and Indonesia, although it does exist in other countries as well. In the United States, leprosy is very rare, but around the globe, as many as 2 million people are permanently disabled as a result of it. Because of the stigma of leprosy, the numbers are estimations only, because many cases go unreported. Between 2011 and 2015, several countries across 3 continents reported over 1,000 new cases of leprosy to the World Health Organization. In Africa, the countries were the Republic of Congo, Ethiopia, Madagascar, Mozambique, Nigeria, and Tanzania. In Asia, it was Bangladesh, India, Indonesia, Myanmar, Nepal, and the Philippines and Sri Lanka. In South America, it was only Brazil. The causative agent of leprosy is a bacterium called Mycobacterium leprae, discovered by Norwegian physician J. J. Armware Hansen in 1873, making Mycobacterium leprae the first bacterium discovered as causing disease in humans. This discovery by Dr. Hansen has also given the name Hansen's disease. Leprosy used to be treated with mercury until mercury was discovered to be harmful to humans. The damage to nerves causes a lack of pain sensation in infected areas, causing some to lose limbs because they do not notice when they are injured. However, the pathophysiology is poorly understood. Currently, it is not fully known how one contracts leprosy. Due to the slow-growing nature of M. leprae, it is extremely difficult to find the moment of infection. However, there is certainty about how it is not contracted and some scientific theories on how it is contracted. Leprosy cannot be contracted from casual contact with the leper, such as handshaking, hugging, or sitting next to a person on a bus or at a meal, for example. It is also not transmitted sexually or from mother to baby during pregnancy. However, long-term contact with someone with untreated leprosy is known to increase a person's chance of contracting the disease by 8 times. M. leprae does exist on 9 banded armadillos in the southern United States and are suspected of being responsible for the few human cases of leprosy in the United States every year. A person with leprosy can be asymptomatic for years. The first sign of leprosy is discolored patches of skin, usually flat, but can also be papular, that may be numb and look faded. Sensory loss at the skin lesions is an important distinguishing factor in diagnosing leprosy, as it separates it from other skin lesion disorders such as tinea versicolor. Skin may be thick, stiff, or dry. There may be painless ulcers on the soles of feet and painless swelling or lumps on the face or earlobes. Weakness and paralysis occurs. When facial nerves are involved, eye problems that can lead to blindness occur, along with stuffy nose and frequent nosebleeds. If left untreated, the signs of advanced leprosy include paralysis and crippling of hands and feet, shortening of toes and fingers due to reabsorption, chronic non-healing ulcers on feet, and facial disfigurement. Hansen's disease, or leprosy as more commonly known, is diagnosed based on clinical presentation, but the diagnosis can be confirmed by a skin or nerve biopsy and acid-fast staining. Some serological tests have been developed and promoted by some investigators, but they lack sufficient sensitivity and specificity to be used as diagnostic tests. For this reason, they are not used to diagnose leprosy. To prevent contracting leprosy, avoid armadillos whenever possible. If you come in contact with an armadillo, thoroughly wash the affected areas immediately. Perform periodic self-skin examinations and contact your healthcare provider if you are concerned about contracting it. Early detection of the disease is paramount because the nerve damage is permanent, even if the patient has been cured from the illness. Multi-drug therapy is the treatment of choice, consisting of dapsone, rifampicin, and clofazimine for 6 to 12 months, although the patient is no longer contagious after the first month of treatment.
अब ठीक हो जाएगा तो पापा आपको ले जाएंगे।
हाँ सर।
बोला है पापा ने?
हाँ।
बताओ।
बोले कि ठीक हो जाएगा तो तुझको ले जाऊंगा।
आपको याद आ रहा है घर का? क्यों रो रहे हो? क्या हुआ?
कुछ नहीं।
It is difficult to combat centuries of hysteria around leprosy. However, there are several organizations in India that are currently working to combat the disease and the stigma of leprosy. The Novartis Foundation has a long-term commitment to leprosy treatment and control. Through the World Health Organization, Novartis has provided free treatment to all leprosy patients worldwide, helping to treat more than 6 million patients since the year 2000. The Leprosy Mission Trust India is an organization that seeks to dispel the myths and the stigma of leprosy through education.